It's ready? Okay. If I can get the committee back together, you want to go back there and we're going to get to start. Not yet. Let's get a few more people here. And that was fun, you know, not okay, let's see. It's always that side that comes back first. Even all the 14 years I've been here. Okay. All right. Are there, okay. Hey, good afternoon and welcome to the hearings for the Health and Government Operations Committee. I am Bonnie Cullison, Vice Chair of the committee and filling in for our chair, Jocelyn Pena-Melnick today. I kindly ask your patience for if we encounter any technical or streaming issues. We've been pretty lucky so far. Hopefully we will continue to be. I'd ask folks in the gallery and the committee to set your electronic devices to vibrate. As a reminder, there's no food or drink allowed in the gallery. For these hearings, we're going to hear from the bill sponsor and the sponsor panel, followed by all in-person witnesses. That's favorable with amendments, and unfavorable, and then all virtual witnesses. I suspect today most of our witnesses are in person. The bill sponsor testimony is not limited, while all witnesses have 2 minutes to provide testimony. A timer is displayed on the screen and sound will play when time is expired. I would ask our committee members to please adhere to our usual committee rules of 1 question and 1 answer and keep your question brief. We do in this committee ask that when a question is asked, only 1 member of the panel respond, and so choose the best person to answer that question. Members of the public will be able to view the live stream of this hearing on the Maryland General Assembly website and YouTube. So today we are hearing bills that are departmental bills from the Maryland Insurance Administration. We have House Bill 23, House Bill 240, House Bill 30, and we'll go in that order. So I would ask the department to come up for House Bill 23, Maryland Health Benefit Exchange, Qualified Health Plans, Dental Coverage. And we will have someone from the from MIA and from the Health Benefit Exchange, correct? Okay. Okay, yeah. Okay, Mr. Cooney, you want to start?
Sure. Thank you, Madam Chair, members of the committee. For the record, I'm David Cooney, Associate Commissioner for Life and Health with the Maryland Insurance Administration. Today, testifying in support of House Bill 23, which is Maryland Health Benefit Exchange, Qualified Health Plans, Dental Coverage, which the MIA developed in collaboration with the Maryland Health Benefit Exchange. So this bill makes a very straightforward change. It's intended merely to codify the status quo and maintain an important consumer protection. Specifically, the bill removes a provision in state law that currently permits health benefit plans sold on the exchange to exclude coverage of pediatric dental. Pediatric dental is one of the 10 essential health benefits that must be included in all individual and small group plans under the Affordable Care Act. However, federal law allows a qualified health plan to exclude coverage of pediatric dental as long as there is at least 1 standalone dental plan offered on the exchange that provides these benefits. Because multiple standalone dental plans have been offered on the exchange in Maryland every year, health carriers are permitted to exclude pediatric dental from their health benefit plans. However, historically, carriers have voluntarily elected to include these benefits in Maryland. However, we've had a few new entrants into the market in recent years, and there are concerns that if a new carrier would choose to exclude pediatric dental, the MIA would lack the authority to prohibit them from doing so. And if this were to occur, the primary concern we have is consumer confusion. Since all plans currently and have for many years included pediatric dental, consumers generally expect these benefits to be included in their health plans. Now, on the off-exchange market, if a plan doesn't include pediatric dental, when the consumer applies for that plan, they're required only application to attest that they're aware of this and that they've actually purchased a separate standalone dental plan. That self-attestation process, though, is not applicable to on-exchange policies. And additionally, due to the way plans are displayed on the Health Connection website, there are concerns that it's not very easy for a consumer to differentiate between the plans that may include pediatric dental and those that would exclude it. So for this reason, there are concerns that consumers could purchase one of these plans without pediatric dental and not actually be aware of what they're purchasing at the time. And since pediatric dental is such a critical health benefit for children, ensuring that all health benefit plans on the exchange continue to provide these benefits is an important consumer protection. Other states have passed similar laws in this area, and in Maryland, we can do it without any disruption to the market since all the health plans already cover this. And for all these reasons, we urge the committee to adopt a favorable report, and I'm happy to answer any questions.
Thank you. I'm going to call Michael Patty up as well because he'll speak after Michelle Eberly. Okay, go ahead, Michelle.
Thank you, Vice Chair Cullison and members of the House Health and Government Operations Committee. We thank the MIA for the work that they have done on House Bill 23, which would require that all qualified health plans cover the pediatric dental plans in order to be certified and sold on the exchange. The exchange supports this bill, and we're very proud of the fact that through the exchange, we're able to offer quality, affordable plans, both in our health space and our dental space. And this will just really, again, continue our ability, particularly for pediatric dental as part of our health plan. So for those reasons and all the reasons that Mr. Cooney just provided for you, we request a favorable report on House Bill 23.
Thank you. Mr. Patty?
Oh, great. Michael Patty here today in support of House Bill 23 on behalf of the Maryland Community Health System, a network of federally qualified health centers across the state, and the Maryland Dental Action Coalition, an oral health advocacy organization. We just want to thank the Insurance Administration and the exchange for making it easier for people to understand the kind of coverage they're getting when it comes to dental coverage. So just thank you, and we ask for a favorable report.
Thank you. Are there questions from the committee? Okay, so Mr. Cooney, I just want you to confirm one thing for me. Currently, all health carriers in Maryland are offering pediatric dental as part of their plans.
Correct, on both individual and small group exchanges.
Okay, so as I heard you say, no disruption to the current market. We're all good.
Correct.
Okay, thank you. Any other questions? Okay, then that completes the hearing on House Bill 23. Thank you very much for your time and testimony. I don't know, Mr. Cooney, if you're going to stay up there or not. And we will go to House Bill 240, which is health insurance cancellation of individual health benefit plans. And this is Michelle Eberly and Mary Quay, who are up there.
Good afternoon. My name is Mary Quay, and I am the Associate Commissioner for Market Regulation and Professional Licensing at the Maryland Insurance Administration, or MIA. The MIA thanks the committee for the opportunity to share its support of House Bill 240, which is a departmental bill. House Bill 240 protects consumers and carriers by limiting the circumstances in which an insurance carrier may terminate an individual health benefit plan, both on and off the health benefit exchange, due to a premium deficiency of $10 or less 30 days after written notice. While not a widespread issue, the MIA has encountered circumstances where policies have been terminated when premium payments were short by a minor amount, even as low as pennies. When policies are terminated due to non-payment, then the individual or family covered by the policy cannot obtain another individual policy until the next open enrollment period for the following January 1st. In 2022, over 240,000 Marylanders were covered by individual health benefit plans, primarily sold on the exchange. Federal law allows exchanges to permit carriers to implement a policy under which issuers can consider enrollees to have paid all amounts due if the enrollees have met a threshold set by the carrier of a percentage due. Carriers have inconsistent policies, and the option does not currently exist off the exchange. If a policyholder is only required to pay $1 each month and the carrier requires payment of 98%, then a policyholder who mistakenly enters 10 cents into their bill payment screen could be terminated. The MIA believes that setting a deficiency limit of $10 or less balances the effects on consumers and carriers and ensures that the amount of underpayment is minimal. For these reasons, the MIA urges a favorable report.
Thank you. Great timing. Michelle Everly.
Thank you so much. And again, many thanks to the MIA for spearheading this bill. We have seen, and particularly with the Medicaid unwind, that we've had a lot of people coming from Medicaid over to qualified health plans, that people who have not ever paid for their health insurance, if they were getting free insurance and now coming through, might miss a payment, have a small payment, not really think they have to pay that 10 cents, 20 cents, and they lose their coverage. And that's a very devastating thing and very expensive to get folks reinstated or get them coverage come the next health plan year. So for those reasons that we've experienced, as well as everything that Ms. Quay has said, we do request a favorable report on House Bill 240.
Okay, thank you. Any questions from the committee? I see Delegate Bagnall.
Madam Chair, and thank you very much for this bill and this presentation. I don't know if you had opportunity to see the testimony of the Office of the Attorney General, and they are in support with an amendment. Their concern that they raised was with accidentally transcribing amounts in payment, which would not provide the protections because it wouldn't meet that $10 threshold. Do you have a response to that, or are you in conversations with the OAG?
We have been having conversations with them, but also our concern is that this should be for a de minimis shortfall that someone intended to pay, and it is unfortunate if they transpose numbers and it was a large amount, but it is intended to be for a de minimis error.
Okay, thank you. Delegate Alston.
Thank you, Madam Chair. My question is slightly off topic, if I could. I can wait till everybody else.
Let's see how far off topic it goes. I don't.
All right. So there was a concern raised to me about the insurance companies, specifically health insurance companies, and the exuberant amount of profits that they're making and then not providing coverage to things and canceling people's policy. And I'm wondering, has MIA ever looked into this to see how these nonprofits are dealing with the excessive income that they have, and whether they're truly providing a benefit that we need to go to our consumers when they're canceling policies for de minimis amounts and then not providing people with coverage that they believe they should be getting. I know that's off, so if you all need to get back to me on that, I'm good, but thank you for indulging.
Do you want to respond?
I can make a brief response and we can follow up later. Under the Affordable Care Act, carriers who sell in the individual and small group markets have to meet certain loss ratio requirements. And that means they have to pay a percentage of premium out in claims and limit their administrative expenses. And so that protects consumers in those markets in those ways. For large groups, it tends to be much more competitive to get that business and in the ways that they set rates. We are concerned about entities that may claim to be insurance companies or unscrupulous people who sell insurance policies that are intended to be supplements but are sold as comprehensive. And we have been taking action in some of those entities.
Okay, thank you, Delegate. Any other questions? Okay, seeing none, then I'm going to call up Matt Celentano. Thank you, panel, for your testimony, and we'll hear from Matt Celentano, who is favorable with amendment.
Good afternoon, members of the HGO Committee, Madam Chair, Matt Celentano here on behalf of the League of Life and Health Insurers in Maryland, here for the first time this year, favorable with amendments on House Bill 240. In some ways, we believe this bill is sort of a solution looking for a problem. We are unaware of any complaints in this space. We haven't heard any really from the MIA. In my discussions with the AG's Health Education and Advocacy Unit yesterday, that there had not been any complaints in this space. The thing that we find challenging the most about this bill is that every carrier already has a policy on this type of approach, and we do not want any consumers to have their policies canceled. The last thing carriers want to do is lose members. Carriers are also required to make a good faith effort under the Affordable Care Act to collect all the premium. And in fact, if the individual does not pay their share of the premium, the IRS will not allow a premium tax credit for that next month. So there are some logistical challenges from carriers on this front. It's also our understanding that the federal government is going to be releasing their own guidance on this policy within the next maybe few months. And we would suggest that Maryland stay the course, especially with the carriers already having policies in this space. So our suggestion moving forward is that if we are going to move forward with a bill, that it would mandate that all carriers have a policy. And if so, if there's further amounts, we would agree with the Attorney General's office that the dollar amount would be more operationally burdensome, and we would suggest to go with a percentage of the premium. We've already had a discussion as a group of carriers with the Maryland Insurance Administration this past Friday. We are favorable. We think we can get to a good place with this bill, and we hope that you will give us time to work it on out and get it bill to the finish line. Thank you very much.
Thank you. Questions? My question is, do you think you can get together before next Tuesday?
What happens on Tuesday at 11 a.m.? I think we would be happy to have another meeting, Delegate Collison.
Thank you, Mr. Celentano. I appreciate that. Seeing no further questions, that completes the hearing on House Bill 240. And we will go to the last bill of the day, which is House Bill 30, right. And that is, our favorite one, health insurance conformity with federal law. And David, I think that's you. And let's call up Deborah Bricado too while we're here. Is Deborah here? Yeah, there she is. Okay. All right, Mr. Cooney.
Thank you, members of the committee. Once again, for the record, I'm David Cooney with the MIA, testifying here in support with amendment for House Bill 30. House Bill 30 is intended to conform Maryland health insurance requirements to federal law. As most of the committee members here are aware, the MIA submitted a conformity bill nearly every year since the Affordable Care Act was enacted. The General Assembly has previously codified many federal health insurance requirements into state law. And as those laws and regulations change, we often have to update our Maryland statutes to ensure continued alignment. Now, it's important to note that the health insurance carriers are required to comply with all these requirements, regardless of whether the provisions are codified into state law. However, ensuring that the state law aligns with federal law provides the MIA with clear statutory authority to directly enforce those requirements on our Maryland carriers. It also provides greater clarity to the industry when the Maryland laws align with the federal laws. And for this reason, the industry has historically been very supportive of our conformity bills. So we haven't actually submitted a conformity bill in a few years, and there have been some recent changes to federal law that now require revisions to Maryland statutes. I'll be happy to go into greater detail on the changes if there are questions, but just to summarize at a high level, we're proposing various changes to address recent updates to federal regulations related to both the Affordable Care Act and the No Surprises Act. Most notably, there are revisions to the definitions of emergency services and emergency medical condition to ensure Maryland law is consistent with the No Surprises Act. There are also several provisions where current state law directs the MIA to refer to federal requirements that were in effect in 2019 in the event the MIA has to adopt regulations to enforce those requirements. And though we haven't had to adopt regulations yet, those federal laws have, some of those regulations have been modified to the benefit of Maryland consumers since 2019. So we're now looking to update that date to 2023. Additionally, there are some minor changes to a special enrollment period for small employers, also a technical revision to the open enrollment period requirements for the individual market. Finally, we want to note that after we submitted the bill, we did become aware of one additional provision where that 2019 date should be updated to 2023. So we're working with committee staff on an amendment to address that issue. And so essentially, just to ensure the MIA continues to have clear authority to enforce the federal requirements, we're urging the committee to adopt a favorable report.
Thank you. So your only amendment is the changing of the one date from 2019 to 2020. I'm going to ask if there are questions of Mr. Cooney, because I think Ms. Mercado is going to come from a different perspective. And so are there any questions for Mr. Cooney? Seeing none. Thank you very much.
Thank you.
Okay, Ms. Mercado.
Good afternoon, Madam Chair and delegates. On behalf of our 200,000 followers across the state, that without an amendment, we do respectfully object to House Bill 30. This bill could use taxpayer funds to further subsidize the abortion industry unless an amendment is added that explicitly excludes abortion facilities. While it's meant to conform with the Federal No Surprises Act, freestanding medical facility is an addition. Abortion facilities are a type of freestanding medical facility, but are not emergency facilities. In addition, the bill expands the classification of an emergency medical condition outside of diagnosis codes. Pregnancy is not ordinarily an emergency, but when it is, the woman is treated at a hospital. Several sections of the bill are vulnerable to be used for out-of-state abortion clinics. For instance, ancillary services are not delineated. While that could mean anesthesia services, there's nothing to say that it couldn't be used for transportation outside of ambulance services. Also, freestanding medical facilities staffed by behavioral health providers are included in this bill. And in Maryland, the health of the mother includes mental health, where abortion is a treatment for anxiety or depression. Although mental health can be an emergency or an acute condition, the condition of pregnancy is not usually the emergency. An abortion performed in an abortion facility for the purpose of treating a mental health condition is not an emergency. So what I would like to say is that Maryland taxpayers, including those that follow Maryland Right to Life, are charitable people. We can agree on the intent of the bill, which is to protect people from unexpected bills after an emergency event. With that in mind, we want the bill to avoid being exploited for other purposes. So let's make sure the bill does what it was meant for. So we ask that an amendment be added to make sure the intent of the bill is clear and that funds are not used for other purposes. Without it, Maryland Right to Life requests an unfavorable report.
Thank you very much.
Thank you.
Are there questions of this witness? Okay. Seeing no questions, thank you very much for your time and your testimony today.
All right, thank you.
And with that, that concludes the hearing on House Bill 30 and the work before us today. So I wish the committee a good evening. Know that these bills will be coming to the Insurance and Pharmaceuticals Committee for our first subcommittee meeting on next Tuesday at 11 o'clock. So thank you all.